Okay, I guess we are live. Hi, everyone. Hello, hello. How is it going? I can see the excitement. How are you? I'm extremely pleased that I'm going to have Dr. Jason Emer with me on the session today. I've been following him for a while, and honestly, like, there's so much he's doing when it comes to skin, when it comes to body, when it comes to skincare, when it comes to new innovation. So I'm super excited. He's located in LA, and there's so much I want to cover with him, and there's so many questions already from you guys. So I'm gonna check if he's on. Okay, I think he's here. Think he is on. Oh, there we
Hello.
go.
Oh,
Good
wow,
morning,
you're so
doctor.
beautiful.
Thank you so much. Good
How are
morning.
you?
Good to see you.
Thank you for having me. You know, you made me wake up so early on a Sunday, but I was so happy to do it. I told my friends and my staff, I was like, this makes me very excited because I have so many clients around where you guys are, plus our new
Yeah.
skincare line, plus I love that you have been following me because you're such an inspiration to everybody in the beauty industry.
Well, I think you're the person who is inspirational in the beauty industry, not me.
Oh, thank you. I mean, you know what? I mean, the people that, get the real answers and look into the newest things for people, they're the
Exactly.
ones that are really inspiring others because there's so much fake news. There's so
That's true.
much photoshopping. There's so much not reality that's out there with all the filters and the face tuning.
Thank you.
So,
Thank you.
so really talking about it makes a difference for people because it helps a lot of people.
Exactly. And this is how I started the whole thing. It's because I really want to benefit everyone around me. If I have something that works for me, why can't I share it with others? So this is the whole inspiration.
Well,
And
I
this
love
is
that.
how, yeah. And this is why I think people trust as well my recommendations and the people I want to talk to, like yourself. So I just wanted to introduce you quickly to the audience. I think a
Thank
lot
you.
of people already know you, but you are you are a board certified dermatologist. But not only that, you are an innovator. Some people say that you're behind the Hollywood's most notorious bodies, but I mean, we'll come to that. You are an innovator in skincare. You have your own skincare line. I mean, there's so much I want to cover with you, which is amazing. All
Yeah, I'm
right.
actually very excited. So however long you want to go, all I got to say is when you're done, make sure to give us the video because I really want to promote it for you. And I
Thank
was
you.
telling my staff too, I would love to do some, like skincare tip lives every so often, even if it's every few weeks where we do a 10-minute what's new in the industry. Let's do it because the whole thing with me is I came here to LA literally knowing nobody, you guys. I was all on my own. I've done this all by myself. And I did my fellowship in San Francisco. And then said I needed to move to LA because I wanted to be the skincare doctor and the laser doctor and the body surgeon for all the celebrities. But I didn't know that there was so much competition here and that so many people look to Los Angeles for the best in skincare and the best in aesthetics. And that's what happened. And with social media and with being real and honest and
Right.
kind, we've really been able to develop an amazing practice. Now, you said the notorious, known as treating the most notorious bodies and faces. I'm kind of like the hidden gem, you guys, of Los Angeles because everybody comes and sees me, but they don't tell anybody they do. And that's because I really care about good work and my patients will pay. And I don't do things for free and I don't tell people to go
Correct.
tell somebody. And this is not in a bad thing. I mean, I don't do things that way because I don't want someone being biased, telling somebody to go to somebody just because they didn't pay for it.
Absolutely.
I want you to
Absolutely.
do it because of good work, because of
Absolutely.
a relationship that you have with somebody, you know?
Absolutely.
So I'll let you run the
Absolutely.
show,
but well, okay, so I need to navigate through the questions, but
thank
the
you,
first
Toodles.
question I have
Yes.
is, you said once, because I've been following you and I've been like noting things down, that you have over 10 laser machines in your practice. Is that true?
We actually have 82 lasers in my practice. I know it's crazy. When I first started, the first year I moved here, I needed to stand out. I wanted to be different, especially since I was a newer dermatologist, a younger male. There weren't that many there. And I said I needed to be the body surgeon. So I started doing all the high-def sculpting, the tightening, fixing the botched work, but also the laser doctor. I started doing a lot of acne scars, a lot of pigmentation. And so my first year, I had 12 lasers. And I'll tell you, when I first started, lasers are expensive, you guys, just so you know. And I've been trying to get over to Dubai for a while now, so I can bring a lot of the laser devices there. And I couldn't get any. The banks wouldn't give me any money. I was all on my own. So I slowly did it. I started with one of the smallest lasers, and I'll tell you, if you have it around, Clear and Brilliant, it's one of my favorite devices. I actually helped develop it. What did you say?
I hear so much about the Clear and Brilliant. I'm yet to try it.
Yeah, you would do great with it because it's great when you just have fine wrinkles. You want to shrink the pores. Pigmentation, you could do it on any skin type. There's no risk. And it just makes your skin glow. It's the Hollywood secret, in my opinion, because people will do it like a week to 5 days before, and right before an event, they look amazing. And it's the low downtime facial, laser facial, and
amazing,
collagen producing.
Do you have any, like, is there any machine that you, when you start using, you say, okay, that's like that's my favorite baby? Yes,
Halo. So there's a device called the Jewel by Saiton, and it has on it many different things. But the biggest thing that it has on it is something called BBL and something called Halo. Now, they have a little bit of a downtime. BBL is a light therapy, like an IPL, but it's more advanced, way more advanced, like the iPhone 11. It's the best in the light industry. And it treats red, it treats brown. If you know how to use it, it literally can tighten the skin, improve crepiness on the neck. It's so good. Thank you, everybody, so much for following. This is wonderful. And then on top of that, we'll do the Halo, which is a little bit stronger of a resurfacing laser. It has 2 wavelengths. It's the only one in the world that combines 2 different lasers together, and they fire simultaneously like this. And one goes deeper and one goes on the surface. It's both ablative and non-ablative. So you're getting the tightening and the collagen production, but you're also getting the peeling and the exfoliation. It works unbelievable. Now, the only problem is if you're, let's say, Middle Eastern, a little bit darker skin, you have to be really careful about hyperpigmentation. So you have to really know, a doctor needs to really know how to treat your skin type. And that's actually why I created this kit from my skincare line called Aerify. If you look inside, there's 5 products. Oh, wait, hold on a second. I'll show you. There's 5 different products in here, which is our brightening and a retinol and a foaming cleanser, a mask, and a sunscreen. This is a brightening and whitening and complexion pore reducing kit with a peel in it that you could do at home every 2 weeks. I have my clients that are darker skin type, mixed ethnicities, sensitive, don't want to do a strong laser. They do this before and after, and they don't get pigmentation issues. And they don't get scarring. So the reason I made this was because I used to send my clients home with this in a mini pack that I would give them. I would give them like 10 of these, and I would tell them, take it on the airplane home. So now we made it here, which I can actually send international. We made it so that it could be sent all over the world.
Perfect. Because, you know, I have so many friends who did actually a peeling and they were suffering with hyperpigmentation after.
See? And that's the thing is on my website, emeragecosmetics.com, we actually do free virtual skincare consults every day.
Perfect.
So even Middle East, if anyone wanted to do it, what they do is they do a FaceTime just like this with my skincare specialists and my estheticians.
Yeah.
Totally free. And then
Fantastic.
if they have products like ones you recommend versus, let's say, some medical grade stuff that we can either sell, we can ship to them, and then monthly they can send in pictures of themselves to our team, and then we keep reevaluating for them. Because so many of my clients, I only get to see them maybe twice a year when they come to me from Middle East. And so I wanted to be able to send the kit. I wanted to be able to send some of the new products.
Well done.
But then anything else they needed. And we can literally ship. I have clients that'll order like 10 months worth of stuff.
Yeah.
And we send it to them. But they're happier because they have a plan. And that's the thing. When I came here, I had those 10 lasers and I had plans for them. Now when somebody comes to me, we have 80 lasers. But that doesn't mean that I need to talk to you about all of them. I need to pick the ones that are good for you.
Absolutely.
And I'm honest, and it doesn't mean every laser works. It doesn't mean every treatment's necessary. Right. When you're looking for subtle improvements, because to me, being beautiful is being beautiful naturally at your own age. You don't need to look 10 or 20 years younger. You just need to look great at your own age. Correct. And so the biggest thing to me is the skin. Your skin, the cleaner your skin, the car wash effect. You just look more beautiful. You're radiant. You know, it's bright. Even if you don't have fillers, even if you don't have surgery, if your skin is, you know, like look at you, you're glowing, you're radiant. You have almost no makeup on and you look beautiful, you know?
I think I was also reading the other day is if you have a clean skin, even if you don't have any fillers, you look much younger. So if you have radiant skin, this is something that and this is why I've been so obsessed with skincare lately.
Me too.
And I get crazy when people tell me I do everything, but I don't use sunscreen. I'm like, guys, like there's a simple, like this is like the simplest thing that you should do every single day. But guys, as Dr. Jason said, they offer free consultations for you. And I think this is amazing, especially if you want to subscribe to his packages. It's not just buying his stuff, but also you'll get free consultations every time you have a concern or every time.
Yeah, I mean, I'll tell you, I'm a solo creator of what I've done, and money to me is nothing. I want people to be happy, and the reason, and that's the thing is that's why even my skincare line that I just created, I'm giving like almost 10% of all proceeds to charities, even though I spent all my own savings to make it. Even the sunscreen, which I literally have on right now because I wanted you guys to see, the Fusion Shield, most sunscreens are whitening. And a lot of my darker skin or mixed ethnicities or, you know, sensitive skin types, they look really matted and brown when you use a tint. But what we did was we made a anti-aging sunscreen that had a vitamin C, marine extracts that actually tighten the skin, the physical blocking and no chemicals, and a tint so that literally anyone could use it who doesn't like sunscreen and get the anti-aging effect that they normally would never do because they're not using the vitamin C or they're not using the algae. Like, look at this. I'll show you. I put it on because I'm like, look, I want to get a little camouflage, a little makeup before I do it. But here's the thing. Even a man would want to put this on because it literally has no matte finish, and then look, it's just brighter, and you look
some
and it's
doctor, okay?
Yeah, I'll send you my whole thing. Yeah, I want you to. I'll send you a couple kits too.
Great, amazing. Okay, so there's one thing that you do. I mean, because I try to answer every single message from my followers.
Of course.
And there's so many questions about acne scarring.
Oh,
and I've seen that you have a very special technique. It's not just you use a laser. You use like a special technique, like after each other, to really to treat acne and to cover the scars.
Yeah, so, let me talk to you about that because again, what I was saying about the lasers is I look young, but I've been doing this for 16 years. And the thing is, which I think is great, it's my skincare and my lasers. The issue is a lot of people want to buy a laser and then just sell that laser to somebody. It doesn't matter what that person has, they just want to sell it. When I look at somebody, I don't look at them and think of a device, and I don't think of a price. I think of what do we need to do to get this person to feel confident again? What do we need to do to make this person feel like they can go out without a lot of makeup and feel confident in high Roger and themselves? To do that with acne scars is difficult because lighting and shadows all around your face play a huge role. You're in the elevator and the light shines on you, it looks different. You have your light here, someone takes a picture, you look different. So you have to treat scars three-dimensionally. So in the office, I have people smile, I have light shining on them. Sometimes it's fillers that are needed to plump the scars, or something called subcision, where it's a needle that goes underneath and it lifts it up. Sometimes the scars are so deep that a laser just won't treat them and it has to be cut out. And you have to surgically remove the scar, and then you laser this new straight scar so it's more even and everything. The other thing is sometimes it's pigmentation or redness, and it's not really the scar that's visible. So that's where treating with a peel like my Aerify Kit or a Cosmolon or an Enlighten, which, so you guys know, some of these peels have hydroquinone in them, which you can't send sometimes to different countries. So we have to get an approval. We can do that virtually. So I can actually get the approval and send it if it's a medical necessity. Sometimes it's pigmentation. And then sometimes it's lasers. But a lot of darker complexions, you can't do the strong lasers. If you do a CO2 or an erbium laser, for example, that's stronger, may cause pigmentation or worsening of the scars. So sometimes it's a combination. The surface may need a laser or an energy treatment, but deep below may need a filler, it may need subcision, it may need surgery. You know those little ice pick scars, they're very small, you know, enlarged pores, they look like enlarged pores. Those never do well with laser. So if any doctor ever tells you you have ice pick scars and you need laser, don't go to them because they don't know what they're talking about. Okay, let me tell you. Those sometimes need TCA cross, where you take a little chemical and you put it into the scar and then a little scab forms. I have a lot of videos on YouTube about it called TCA cross. And then sometimes those need consistency. They need at-home derma rolling. They need microneedling regularly. Thank you guys so much. And then the last part is, and this is the biggest thing, and I'll tell you because I know people were asking you questions about Morpheus treatment. Microneedling radiofrequency, let's talk about that. Microneedling radiofrequency, hi guys, is probably the gold standard energy treatment for those with sensitive skin. You have sensitive skin, you have dark skin, the risk is minimal to you. But the problem is, Morpheus, for example, is a tightener. It's not going to work that much on complexion. So I've been doing it every 3 months since it came out, but for someone like you, it's great because it's going to tighten the jawline, it's going to make the cheek a little lifted, the brow, but it's not going to help a lot with the wrinkles. If you want to improve the wrinkles, you'd have to do Fractora, which is a more superficial version of the Morpheus treatment. So, but there's other devices out there. There's Infini, there's Vivace, there's EndyMed Intensive. All of them are good, but they do more texture. They do more of the superficial texture, the pores, the scars. But the Morpheus is the tightener. If you had to pick a device that I would tell everybody to do regularly, every 3 months on the dot, Morpheus. But if you want to treat your scars, you guys, it's not going to do it. It's not going to work.
So many people ask me about alt therapy. So I need your honest opinion about this device.
Let me tell you my honest opinion, because I love alt therapy, but I'm going to tell you why. Everything, this is how I put things in perspective, and I'm sure you do too, because you seem to be the person that puts the beauty and the happiness in everything that you can.
Correct.
But you unravel the unreal and unrealistic expectations.
Absolutely.
All therapy is, to me, what I call the clock stopper. You don't see a result from it, okay? It keeps everything from speeding up. It makes the aging process slow down. So for example, if you do Ultherapy once or twice a year, which I think you should, when you are 10 years older from now, you will look younger than all of your friends that don't do it. But
Okay.
it's not going to show you a result right now.
Okay.
So you have to be okay with doing a treatment that you're
Okay.
not going to see an outcome from.
Okay.
I'm almost 40, but I look a lot younger when I don't have my beard. That's because I do Ultherapy on my neck and my eyes once or twice a year.
Okay.
And it keeps it from falling. It slows it down. But I don't expect to see anything. I don't actually think Ultherapy works on the whole face.
Exactly.
I don't
because
like
I
it
did
in the mid
once.
face.
I felt like my whole, like, I lost volume when I did it.
Yeah, I mean, look, it's possible if somebody doesn't do it correctly. If they do it right, you should only get tightening prevention. So probably someone did right. Now a trick, and I don't know if you guys use Sculptra that frequently over there, but Sculptra is an injectable that's not a filler. And it tells your body to produce collagen. It lifts the skin, it volumizes. We use it with Ultherapy and we use it with Thermage. And when you do that, it seeds the area with this collagen producing material that gives you more collagen, more lifting long term.
That's the thing.
So my opinion is you need to do these treatments once or twice a year, usually with Sculptra or combining it with your every 2 or 3 months of your Morpheus treatment.
Okay. So Morpheus and Ultherapy both are tightening, correct?
Right.
So
but the difference is Ultherapy is tightening the muscle. Morpheus is contracting the skin.
Okay, so
two different layers.
Okay, so Ultherapy goes deeper?
Well, no, hold on. Actually, you can do Ultherapy at different levels. You go 4.5, 3, or 1.5. So you can do it, but in general, yes. Ultherapy is doing more of the deeper tightening, and the Morpheus is doing the actual skin contraction.
Got you.
Itself. So, you know, in general, and I don't know if they're asking you or me about the coffee, but I got my coffee right here, you guys. I love my coffee. I'm lucky that my teeth are so white, see? But even with my coffee. There are negatives, because they're asking right now, there are negatives, you guys, to every treatment. That's what I need you to understand. You're going to go online, you're going to see somebody that's been burned, somebody that's had a bad result. Nothing in life is perfect. I always tell people it never will be. Even fillers. You could do the best filler injection and some people might get a little swollen, or maybe the filler moves a little bit. You know, you have to have the realistic expectations. With my clients, they love me so much because I'm real with them. And I say, look, if something happens, come here, we tweak it, we fix it. You want to develop that relationship. You don't want to just say, oh, this didn't work, I don't want, no. You wanted to build that long term. So my clients, we set up that yearly plan. That yearly plan would be, you do your Morpheuses every 2 or 3 months. You do your Clear and Brilliant every month or 2. Your facials and your microneedling in between. I send you the skincare wherever you are, all over the world. Every month we'll get you replenished. You'll do your kits, and then you come and do fillers once or twice a year, and that's all you need. If you do those, you'll look beautiful. Now, if you have scarring or melasma, we have to do something different, because you're going to need something more aggressive, and you're going to need something more time consuming, especially melasma. You know how many women, after they have kids, they develop a little bit of pigmentation. That's difficult. But you know what the best treatment for that is? Skincare. Skincare, hormonal treatment, and sun protection. Actually, it's better.
Yeah. But for example, the Clear and Brilliant, because I'm getting messages is from what age do you recommend? If you have good skin, but you just, want to correct tiny
Yeah,
details.
like pores and fine
Yeah.
prevention. Do
Yeah.
it now. I've been doing it since I was, well, it didn't come out then, but I had it. I've been doing it since I was 26, basically.
Wow. Okay.
So I think, at least every 6 weeks if you can. Now, my goal was this past year to be in Dubai and then have these treatment plans for everybody every 2 to 3 months. That was my idea. Hopefully, we'll be able to do that in 2021.
Hopefully.
Yeah, that's what I hope. But,
Great.
I mean, in general, I think you really need high quality skincare, which was actually why, and I know you love skincare, but I want to give you an example. This was why I made my line. So my vitamin C, which is called AOC, there's
Yes.
tons of vitamin C's that are out there, okay?
Yes.
But the reason I made this one was specifically for melasma and specifically for people who wanted to have a really potent anti-aging antioxidant. The other vitamin C's are less percentage. This is 20%. But 20% at the average skin gets irritated. So we put in here blueberry, we put in here tamarind seed, and we put in here an agent that made it where it's clear. Let me show you this. It's completely clear.
Because usually, they have like this pigmentation after like.
Exactly, there's a color. Yeah. So because this is clear, it's very good for sensitive skin. Excellent. So we developed this. You can put this on immediately after a laser and actually heal faster without any burning.
Wow.
That's why we made it, to fix trauma. It's actually, interestingly, so someone's asking, is it similar to C. ferulic? Yes. It's actually not, because C. ferulic has the ferulic acid in it. It's also oil-based. So C. ferulic's more of an oily serum. This is an anhydrous velvet. Velvety texture. You could actually mix them if you had very dry skin, but you don't need to do that because this is more of a velvety texture. So, we made different things, like even my eye serum, this is my favorite thing, is a very potent growth factor serum. It's made to be used after you did micro rolling or you did a micro needling or a laser to help you heal. But because it was made for such trauma, the everyday use, you feel it, you see it right away. This is called the Refit Eye. There's also Refit Face. So we made it, to enhance sort of the products that are already out there, because there's so much more that's embedded in this in a quality concentration. A lot of the medical cosmetic product lines that are out there have small bits of actives. This has much stronger actives, small amounts of stronger actives.
So a question came, what is it exactly good for? Is it for dark circles, for wrinkles, or?
The eye serum?
Yeah.
So prevention of wrinkles, dark circles, and tightening of the eye.
Okay.
You will actually feel this working because it has a almost like a neuropeptide in it that tightens the skin like a Botox.
Got you. And doctor, one time when you were doing your night
routine,
you were talking about placenta, and you said, guys, watch out. Placenta is a very important ingredient right now in skincare.
Yes.
What exactly is placenta?
So let me tell you. So there's different types of growth factors and peptides.
Okay.
In mine, there's plant and synthetic human. Placenta is not from a baby. It's from a plant. Okay. Although I will say there is different products coming out that are made from those. This vitamin C, you guys, because they're asking about, is my own, actually. It's EMERAGEcosmetics.com. It's very strong. I would love for you guys to support it, because charities, I'm giving money away to different charities for it. But you can, I'll tell you, I actually still even use SkinCeuticals. I know you're asking about it. I love it. I use the gel with this twice a week, but I use this every other day. I use it, so they're different. This is a stronger vitamin C that's anti-inflammatory. So if you have redness, this is going to improve that and help you after a laser. Whereas the SkinCeuticals may give you a little bit more resurfacing from the vitamin C. My
I use the Florentine CF because I have very oily skin. It really helps.
Yeah, that's perfect. I actually think you should try the gel. Have you ever tried the gel or
No.
using the serum? So the gel is a new formulation. It has a
Okay.
lower pH, but it penetrates more into the skin.
Okay.
And it tends to be that men like it better because they have thicker skin. But if you have oily skin, combining this with the gel is what I do, and it's amazing.
Okay.
You would
Okay.
love it. So
Okay.
with that said, there's different peptides. There's human and there's plant.
Okay.
I like a mixture of both, you guys. Look, someone's saying the gel is way better. I want your line. Thank you so much. If you guys do, emeragecosmetics.com. We will do virtual consultations with you free. We'll go over everything with you. The Refit Face is made of synthetic human as well as plant because I like a combination. There's a product line called EMK. I don't know if you know them. They're a Beverly Hills brand. They're all plant placenta. Very calming, very powerful. They have a gold serum. They have an alpha mask, which I love.
Okay.
It should be like the go-to thing. It's like $30, very inexpensive,
Okay.
high quality mask. But they're EMK. I think honestly, if you're going with plant and a combination, you can go with Refit Face and Eye, which is what I have. Now there's another line called Anti-Age MD. Oh look, someone says they love EMK. I do too. They're my friends. They're great. There's another line called Anti-Age that's human bone marrow, probably the most potent stem cell and polygrowth factors in the world, to be honest, because they're human grade. And they have two products in the serum and the accelerator. So what I do right now, I take my Refit Face and Eye and I mix it with both of those because I want a little bit more human amongst the plant. But if you had to choose, this is very potent, good enough plant. If you wanted it the best, you could add both. No line is going to be able to have both at highest quality. It would be thousands of dollars. It's impossible. So if you want good quality of everything, you're going to have to pick and choose.
This is what I do.
You know, right, and that's just the bottom line. You're just going to have to do it. Now, I also think you need to have a hyaluronic acid. You need to have a strong hyaluronic acid.
I don't use it. I don't use it, doctor. You know why? Because it makes me, sometimes it makes me break out, or maybe I'm using the wrong one. I don't know.
Yes, that's why. So I'm going to send you mine because you need to try it. It's 5 molecular weights. It has in it vitamin B, tamarind seed, and 2 different marine extracts. Completely calming. I've never seen once any acne at all, and it's calming. So I'm going to cross my fingers with you. Now I want to tell you something. My kit, which I have right here, they're asking about melasma. If you want to improve melasma slowly but minimal risk, you could do this every 2 weeks, and you will have beautiful skin in a few months. Very, very calming. Very calming.
I think, doctor, there's so much information. We need to do the skin line.
Let's do it. We'll do it like every couple weeks.
Yeah.
I'll do it every few weeks, and we'll pick a topic for 15 minutes.
Exactly.
But I want to show one thing. The Hyla A that's in my kit, you can't buy this. It's in the kit. You can buy it in the kit, but not alone. It's vitamin A.
Yeah.
But the thing is, I mixed it with hyaluronic acid and licorice root because I wanted people to get the plumping, the hydration, and the collagen production at the same time they get the brightening.
Yeah.
Most retinols irritate people. They get the skin get irritated. This does not because it's hydrating. So when you're looking for retinols or you're looking for things, you don't need to be drying out. You want the skin to glow. Excuse me. You want the skin to glow and plump. And that's what we did with the line. So in
retinol,
general,
right? That's like kind of retinol. You call it like a retinol, like the vitamin A. Okay.
Yeah.
Okay.
I wouldn't choose a retin-A or tretinoin because those dry the skin out.
They do.
When you're looking for cosmetic, you want it hydrated and radiant. That's why we're using this type of retinol that has in it. And I want to tell you guys something. They're asking about Asian skin.
Yeah, I just
First off, my best friend here is from Shanghai. She is one of the most well-known skincare scientists. She made this kit with me for my Asian clients. So all of the products in our line is safe in dark skin, Asian skin, Middle Eastern, mixed ethnicities. However, not all skincare lines understand diversity.
Correct.
So for Asian tones, some are very porcelain and calm, and some are terrible acne and pigment. So you need to do a virtual consult with me or my team so we can really understand what's the best. And we do sell Faith. They're asking about the brand Faith. Have you ever used Faith?
No.
I'm going to send you that too.
Crash course today.
I'm going to send you that too because it's a Japanese line that is made of all collagen and calming hydrators.
Okay.
And it's really amazing. It was designed for those with sensitive skin who had cancer that were very irritated when they were on chemo. And they needed something to calm their skin down. And the Faith line calmed the skin, made them brighter, made them look better. There's actually a product, you guys, this is a top secret, okay? It's called the Essence Serum. It's the only collagen powder in the world that's high potency, as strong as an old filler. And it has a vitamin C that you mix with it. It is probably one of the best products I've ever used. It's called Faith. Yeah, it's it looks 2 jars, you mix them together. And it's a lotion, it's a serum you put on once a day. And it's made of collagen and vitamin C. It's called Faith Essence Serum. It is the go-to anti-aging. Hold on a second. Let me show you. This is how much I love it, you guys. This is how much I love it. It's in my fridge. It's right here. The Faith Essence Serum. You can see it's a little cloudy mixture. It looks like sake.
Yeah. And
it's because it has both the collagen and the vitamin C. I actually mix this with my vitamin C and the SkinCeuticals.
Wow. That's every morning or night?
I do twice a day, but I'm used to it. You could do it just the morning. I think the Faith Essence should be mixed with your growth factors, your peptides. So your refit and your anti-age, you would mix with those. But let me show you. This is how authentic, you guys. Look at the back. No English. This is from Japan. This is super high quality, stem cell research quality. So if you want, this is why I love the product, because it's literally, it says Faith made in Japan right here. It's so good. So we import it from Japan to our clients. We absolutely love it. The Faith Essence Serum. Amazing. Twice a day, mix it with the EMERAGE skin. But in general, all these things need to go with the lasers and with the needling treatment.
Yeah, of course.
You know, and obviously this is your maintenance plan. And so, yeah, I mean, look, there's thousands of products. We actually sell over 400 in our office, including mine. I don't tell people just to buy mine because I think everything needs a mix, and every skin type needs to be looked at independently and choose the one that works the best. Image Skincare is okay. It's not a really good medical brand, you guys.
Which one?
They're asking about Image Skincare.
Okay, yeah.
It's okay. I mean, you're going to get some, they have some products like a pumpkin mask and things like that. It's not going to give you that medical grade treatment. Like, you want her glow, you want my younger skin. We need medical grade, you know?
I think, doctor, I honestly love products that have scientific backgrounds behind them. I don't really care about all the glam that you see on social media or who is using that. I really want to have products that are backed up by science and doctors. That's all.
Well, the thing is, like, someone's asking right now about the Faith Gel and Lotion. Those have been studied. I mean, they have used these on cancer patients, showing redness decreasing significantly. I use both. I love it. They're asking about Definage, which is made basically of a mixture of different anti-inflammatories. There's studies on it. We don't like it because it didn't show a ton of results. It was too slow, but it's not something, it's not to say that you can't add it into something. You know, that's the thing. Like, I like to see results. And that's why I like the kit that we made. If you guys go to all my EMERAGE Skin website and Instagram, you'll see pictures of real patients. They literally send us a picture 2 weeks later. Here's my face, here's my face. The result. We see the results. So we want things that work and are backed by science, which is why we're talking, because I'm real with it. Some, you know, some of the product lines, they're okay, but they're not going to show you a lot. You know, in general, like for example, Emer, which has great marketing, doesn't really work. It's more of a moisturizer, way overpriced, you guys. You don't want to pay for something like that.
So, doctor, coming to the next,
yeah, let's talk.
You want. So, in your opinion, what is the biggest myth in skincare today?
I'll tell you right now that okay, couple things. That one laser or one skincare product or one treatment is going to completely make you look younger and reverse your aging. It's just like working out and your health. Your skin needs to be trained, just like working out. You have to get a facial every month. You have to use skincare and sun protection every day. You have to do lasers every couple months. It's got to be a routine. It's got to be a part of your lifestyle. So I think the biggest myth is that people think that they're going to go get a treatment and it's going to make them look so much younger and it's going to reverse all their aging, and then they're never going to age. You're going to age no matter what. But the stuff we're going to do is going to keep you looking good and slow it down over time. And that's why, like, even my kit, I was talking to clients of mine, and they're like, how many times do I need to do this? And I'm like, there is no number of times. I do it twice a month. It's a routine. You need to be consistent with it. So, yeah, if you wanted good skin, do this twice a month, right? And if you have melasma, maybe you do it more. If you have great skin, maybe you do it just between your facials. But you gotta keep consistent. I think the biggest myth is that you don't need consistency, and they don't think it's like an exercising. I tell everybody, this right here is skin gym. You gotta be training your skin, you know. And that's, I think, the biggest myth. Or like certain things that a laser is going to reverse all your scars in one treatment. It can't. I wish I could make acne scars go away in one treatment, but I have a patient right now who has 90% of her face in scars. It took me 3 years to get her 70% improved, but her life has changed.
Yeah, of course.
But it's a routine. I mean, you obviously have beautiful skin because you've been doing treatments for, I'm sure, a long time. You know, I have patients come in and go, oh, I've never done a peel before. I just want to do this one. I go, I do a peel every 2 weeks.
Yeah.
For 10 years.
I got you. And also some people ask me, like, I've been using this cream for a week and I haven't seen any results.
I know. Consistency. You got to be consistent. You got, even skincare, you guys, just so you know. Hi, guys. Love you too. Even though you use it consistently, it takes 6 to 12 weeks to really know if skincare works, because it's turning over collagen. The reason I like the kit is because you at least see something in 2 weeks. It does do a peeling. It does help blemishes. It does even the tone in just 2 weeks. So you at least see something fast and people feel better. You're getting ready for a wedding. You're taking pictures, a headshot. You want to feel good quick. This will do it, but a regular routine takes time. And you look at the celebrities that people love to follow, they're doing stuff every day. I mean, I'll give you an example. J-Lo probably spends $50,000 to $100,000 a month in taking care of her health and her skin, because she has trainers, dietitians, food, skincare, facials. So you have to be willing to invest.
I agree.
You know, in taking care of it.
Of course. I mean, I think this is very important, and I think everybody who's listening and who will listen to the live after we post it, I mean, it's very, very important that, I mean, for example, like if I use hyaluronic acid, for example, after 3 days, I have huge breakouts, and I don't understand why. But usually if something is working, you need to wait at least 6 weeks, correct? Yeah, I mean, like, look, some people, about 10 to 15% of people are allergic to vitamin C. And some people, certain products just don't work. You may be that exception, but that doesn't mean that we can't find something that really does work, you know? And they are asking a question. I know you had that here. What is the best treatment for pores? All these pores right here.
I know
So
everyone
what to
hates
do,
them.
doctor?
There is no best treatment. That's the thing. But, okay, listen. Clear and Brilliant as a laser, at-home derma rolling, which I have a whole protocol for. If you did that weekly and you did like these types of peels, for example, consistently, and you use a very strong retinol on the pores every couple days, they will be very shrunk. If you look at mine, I barely have any pores. That's because I use a lot of retinol. I use really strong vitamin C. I do derma rolling once a week. I use a quick sonic silicone cleansing brush, and I do lasers. So it's a mixture of things. Now you got to get extractions. You
I
need to
just
go to
did.
the, they hurt. You did? Yeah, you look beautiful. That's why. You got to get those open because they look bigger when they're clogged, you guys. They look bigger. And just so you know, I don't sell a toner yet because our toners are coming out at the end of the year. But I do have a favorite toner, and I'm telling you, you're going to love it. It's vitamin C, botanical extracts, marine extracts, and I think there's hyaluronic acid in it. It's called Rev Skin Acne Purifying Enhancer. It has a little bit of salicylic acid, vitamin C. It was made for Asian skin type. It's only, I think, only $30 or $40, and it lasts 2 to 3 months. It is so amazing. EMERAGEcosmetics.com, Rev Skin. I'm going to write it in here right now, actually. Rev, because I like it so much. Skin. And it's not just for acne, I'm going to tell you, because you can use it for pigmentation or acne on the body. You could use it just to make the area glow and get rid of sun damage.
Okay.
It's amazing. I'm going to write it here. Now, my kit, you guys, because they're asking, is $250 because it has a peel plus 2 weeks of skincare. So it's really valuable, actually, because some products, are $250 for one.
I know.
It's crazy.
I know, it's crazy.
And it doesn't even work. This is fully medical grade.
Let's not mention the names.
Oh, no, I'm not. But I'm just saying, in general, some of them, you just have to have the expectation that they're going to make you glow. They're going to make your skin look bright, but it may not be for melasma. It may not be for acne.
Correct. And also what I've seen, that you have like a micro needling pen.
Yes.
Like a special one. But let me tell you, a friend of mine did micro needling. She had a bit of acne. And all of a sudden, her face broke out like crazy. She had to take Roaccutane after.
I've seen this before. Probably wasn't done just correctly, to be honest. I mean, even during the treatment, we do facials and cleansing before all extractions. We do the microneedling, and we put enzyme, glycolic acid, and vitamin C on immediately. So, in general, even my product line, I just came out with an enzymatic polish that's made of papaya, salicylic acid, lactic acid. Oh my God, it's really good. You can actually put it on as a peel mask for 10 minutes after micro-rolling. You need to do that when you do microneedling, when you do rolling at home, to keep the skin really clean.
Got you.
So I don't know the situation.
Because I heard microneedle it at home, if you don't know how to do it, it can really damage. It can.
So this is why we do the virtual consults, because what we do is we'll send people the rollers, and then they can literally do it with my skincare consultant live on FaceTime.
I think this is extremely important because I have one.
But you don't use it as much, So then I'm going to have Lindsay reach out to you, and then you guys should make a video doing it together.
Okay, done.
Because we will show you the exact protocol on how to do it.
Okay, perfect. And so you talked a lot about your products, but which one is your favorite?
Of mine or other people's?
Yours. Which one is your favorite?
So here's what I would tell you. I really think the kits and the growth factors are very unique. Everything else is what you need regularly, and there are other companies that have them. It's just my combination makes it better for my specific patient types. But the kit actually gives you results. And that's why I love it so much. The Aerify, which I'll show again. I love it because inside, I'll show you, there's this mask. It's called the Illuminating Mask, Aerify. And it has in it two components. One that turns the skin over so you lightly peel, made of kojic acid, arbutin, niacinamide, and vitamin C. Okay? The other component is acid, TCA, lactic acid, salicylic acid at very low strength. Okay. So it won't burn the skin or cause problems.
Correct. Yeah.
I love that because you can use this on the elbow, the knees, the neck, the groin area, anywhere you have pigmentation or you want improvement, you can chest, you can use this. So you're going to see a result right away, like very quickly, which is why I love that. The peptides that are in this are super potent polypeptides.
That's the ice, right? That's
the eye one. Every beauty editor I've given this to, you're going to see at the end of the year, are all writing about this, the hyaluronic acid, the vitamin C, and the kit. They all love the refit because they feel it and see it within a few weeks.
Okay.
And if you guys want, because they're saying, can you guys show, if you guys want any information, I'll post the website. Just go there and do a virtual consult or go to my YouTube. We have tons of videos. And I also have on my IGTV, you guys, I have videos of me showing an hour of how to use this. So it's all there. Just do the consult with us.
Okay. Guys, did you hear? Like, it's for free. Like, I mean, this is like...
Yeah. Lindsay loves doing it. My whole team.
Right? So, guys, you guys need to... You just go to the website, take a consult, and you'll have your
virtual consult. I'm going to post the website. Just go right there. It's posted. Just go there and do virtual consult. And then we'll have a long-term plan. And we do shipping everywhere, entire world, the entire world.
Perfect. I mean, the time is kind of running out, but this is the question I always ask, and you kind of touched on it. Because, you know, I've been in the world of social media for so long, and I see so many young girls that are obsessed with a certain type of beauty or think that they're not beautiful enough. And I want to kind of break this myth and the stereotype. You don't have to look like somebody. You don't have to have a body type like somebody. So since you're such a leader in your field, for you, how do you define beauty?
And that was kind of what I was saying before. To me, real beauty is just natural, subtle enhancement that make your own face, your own skin look the best. I am not about, the reason people go to me is I like subtle, natural results. I like to prevent the aging process as we go on. I don't like to change people, except when it comes to the body and I really want to give them something, you know, really defined and different. Yeah. But with the face, I try to make things subtle, enhanced. You have to take what you have that's a signature feature and enhance it. So if somebody has, you know, higher cheekbone, let's make that a little bit more beautiful. That makes them stand out. Just having a big lip doesn't make you stand out. Actually, it makes you stand out negatively. Correct. So to me, it's all about enhancing those subtle, beautiful enhancements. Those I call it signature feature enhancement. That's what I like to do. And the car wash effect. You really need to get that clean skin to look more beautiful. And changing yourself doesn't make you more beautiful. And yes, we do see patients in New York, Los Angeles, and Chicago. Just do a virtual consult. We'll set it up. Fantastic.
Doctor, thank you so much.
We need to do this regularly, I think.
Yes, we will. I'm so excited.
Let's email and we'll create a little segment where we do every couple weeks. And we'll do a whole, any myths you want to talk about, any skincare products, any procedures. We can even do it if you want, maybe during the week, we can do a procedure on my live that we talk about your staff wants, that your followers want to see.
Of course. And also the next thing that we should tackle, which is coming up so much, is the neck.
100%. I actually posted yesterday a bunch of neck surgery results if you guys want to go see. Obviously, please follow EMERAGE Skin, EMERAGE Cosmetics, and Jason Emer MD, because again, like I said, I'm giving a lot of away to charities, and a lot of my patients, they just like to show the reality. So I showed yesterday a neck lipo and heating procedure, and my patient selfie in her videos. This was a patient, I mean, this is so dear to me, who lost 200 something pounds.
Wow.
She had body surgery with us, and then she needs a facelift, but she didn't want it. So we did the internal heating, and look how confident she is with just the Morpheus plus the liposuction.
Amazing.
She is so confident, and she never had that in her whole life because she was overweight and just didn't want to look at herself. Now she loves her face and her skin. That's what I like to do.
Amazing, doctor. You're really, really inspirational, guys.
Love you guys. Love you too.
Much more of your time. You're amazing. Thank you so much.
Thank you. I appreciate it so much.
We will cover, and
this is a start of our big friendship.
Yes, exactly. Thank you so much,
you guys.
Thank
Bye.
you.
Have a great week.
Take care. Have a great Sunday.